So, we'll do a quick review. When I started to talk about this last week, I wanted to remind you about what coaching was. And coaching at the very highest level is all about listening and watching. It's about asking questions, and we're actually going to look at a few of the kinds of questions that you might want to ask if you're a coach. But at the bottom of it all, it's trying to improve people's performance. So one of the things I think is really important is to understand what coaching isn't. And in spite of what you may have seen on television and football games and basketball games with angry coaches yelling and jumping up and down and dressing down their players, that's not what coaching is about. It's certainly not what we want you to take into the operating room. Coaching's not about telling people what to do. It's not about criticizing them. And it's really not about instructing them on the site about what to do. It's way more about helping people come and helping people learn what it is that can improve what they actually do. Now, a big piece of coaching is asking the right questions. And in order to get really good at this, you need to practice it. But the basic format for asking the questions actually is pretty straightforward. You can see 3 example questions here, but they all follow the same basic pattern. And that is some kind of a statement that says what you saw, what you observed, what you consider to be the facts, perhaps even with an interpretation of those facts, but then asking the people who you're coaching what they think about it. So you notice that something happened, and you ask the people that you're coaching, can you help me understand why you did that? Can you help me understand what you were thinking about? Can you help me understand better exactly what happened? I saw that you did whatever. Can you explain to me why that happened? Or how we might have done that differently? The basic idea here is for you to make a statement that you clearly observed, that you consider a fact, that may even contain your opinion, but then to ask the participants, the people who are being coached, to help you understand better exactly what it is that you saw. And a lot of times, when they have to think about how to answer that question, they can solve their own problems. I think if you try this technique a little bit, you'll quickly see that it actually works to have people solve their own problems. Because what you don't want to do is make an observation and then tell people what to do. It won't stick. If people come to it themselves, and it just makes common sense, they're much more likely to remember what it is that you were trying to lead them to. So who makes a good coach? And I think this is really important in and around the operating room because there are people, and I think we can all think of them, who probably make really good coaches, and then there's other people who probably shouldn't coach other people. So just at the very highest level, a coach is somebody who's coachable, because if you can't be coached, you probably don't have the insight and the sensitivity and the level of understanding it takes to be able to coach other people. They should be respected by their peers, and I think that kind of goes without saying. And they need to understand how to give feedback in an appropriate way. The coachable piece obviously fits right in with that, because if you can take feedback, chances are, in a reasonable way, and use it in a positive sense, chances are pretty good that you would be able also to give feedback. So this, I think, is an interesting way to look at kind of the progress of where we've come with the checklist in the operating room. So if you think about the way that you've learned to do a lot of things in your life, from how to play baseball, how to ride a bike, how to use PowerPoint on your computer, probably the most effective way of doing it is to have a teacher. And that teacher in the very beginning demonstrates for you or teaches you how to do something. So you go from the show me how to do it to the coaching piece. And the coaching piece really then carries that show me or teach me into the watch me and see how I do it and then give me feedback. So all the work, or pretty much all the work that we've done up until now about bringing the checklist into the operating room has really focused on the show me, teach me, let me practice piece of putting the checklist in place in the operating room. Now, what we want to be able to do is to go into the operating room as coaches and watch me, and then, in an appropriate way, give me feedback. And if you think, again, about how you've learned things before in your life, how you get that feedback is really important in improving your own performance. So, as you do coaching, there's a group of things that you really need to think about. And none of this is rocket science. You need to think about what you saw. So what did you see in the operating room that might lead you to give or to comment on the performance that actually took place? So what did you see? And then you need to think carefully about who you're talking to. Because the who you're talking to, and we'll touch on this actually when we go into the operating room in a minute, the who you're talking to is really important. Because when you're going to watch an entire team performing in the operating room, you almost always want to keep your coaching at the team level and not drop it down to the individual level. If you need to talk to individuals, the proper way to do that, most likely, in most circumstances, is to take it and deal with them as individuals rather than coaching them as an entire team together. And then the last piece of this, and it just makes sense, if you're going to go into the operating room with the intention of coaching the people there to improve their performance around the checklist, you need to be very sensitive about what's going on in the operating room when you're actually doing that. And by that, I mean, does it look like the case is starting smoothly? Have things gone along well up until the point where the checklist has been performed? Because there are going to be times when coaching in the operating room is not an appropriate thing to do at that time. So you shouldn't put the coaching certainly shouldn't put the coaching in front of the patient, and you shouldn't put the coaching in front of the team's welfare. If it's not an appropriate time to coach, then you shouldn't insist on giving feedback. Now, as far as your observation is concerned, you remember this is the first half of those coaching questions where you want to say what you saw. You need to be specific and you need to be clear. And by that, I mean that you need to cite specific things and address specific things, not generalities. Because people, especially when they're being coached, need to know exactly what to focus on. So when you give your feedback, there's 4 little principles here to guide how to do that or what you ought to think about as you're giving your feedback. So you want to keep it simple, so people can understand exactly what it is that you're talking about. You want to keep it focused, and that's part of the clarity thing. You don't want to try and talk about something that's very nebulous. You want to be very specific. You want to be focused. You want to be very respectful of the people who you're coaching, because there's nobody that goes into the operating room to do the checklist that's going in there with the intent of doing anything but a good job. So you need to be respectful of the people who you are trying to coach as human beings. And then finally, and it probably doesn't even bear saying, but I'll remind you that you need to be kind. And not all coaches are kind. And there's sometimes when you're put in a coaching situation where your first impulse isn't to be kind. But always remember that. Keep it simple, keep it focused, be respectful.